Hi, I'm Dr. Fred Eccles, Acting Director of Health for the City of St. Louis. Welcome to this week's segment of Ask Dr. Eccles. ST from zip code 63103 asks, do you recommend using a face shield as a COVID-19 face cover? A face shield is primarily used for eye protection for the person wearing it. At this time, it is not known what level of protection a face shield provides to people nearby from the spray of respiratory droplets from the wearer. There is currently not enough evidence to support the effectiveness of face shields for source control. Therefore, the Centers for Disease Control and Prevention does not currently recommend use of face shields as a substitute for masks. However, wearing a mask may not be feasible in every situation for some people, like individuals who are deaf or hard of hearing, or those who care for or interact with a person who is hearing impaired. Although evidence of face shields is limited, the available data suggests that the following face shields may provide better source control than others. Face shields that wrap around the sides of the wearer's face and extend below the chin, and hooded face shields. Plastic face shields for newborns and infants are not recommended. VN from zip code 63106 asks, when you get COVID-19, how long does it take after you recover for you to then test negative? Most people do not require testing to decide when they can be around others after testing positive for COVID-19. But if your healthcare provider recommends testing, then they will let you know when you can resume being around others based on your test results. As a general rule, you can be around others after 10 days since symptoms first appeared and 24 hours with no fever without the use of fever-reducing medications, and other symptoms of COVID-19 are improving. Loss of taste and smell may persist for weeks or months after recovery and need not delay the end of isolation. AG from zip code 63139 asked, will getting the pneumonia prevention shot give you any advantage if you contract COVID-19? The vaccine for pneumonia is called the Pneumovax. This vaccine helps prevent pneumococcal disease, which is any type of illness caused by Streptococcus pneumoniae bacteria. Vaccines against pneumonia do not provide protection against COVID-19. The virus is so new and different that it needs its own vaccine. Efforts are underway to study vaccines that have been developed to provide protection against COVID-19. Although pneumonia vaccines are not effective against COVID-19, vaccinations against respiratory illnesses like the flu are highly recommended by the City of St. Louis Department of Health and Centers for Disease Control and Prevention. Getting a flu vaccine is more important than ever this flu season to protect yourself and the people around you from flu, and to help reduce the strain on healthcare systems responding to the COVID-19 pandemic. NV from zip code 63115 asked, how much COVID-19 must you be exposed to before you acquire the disease? And if you are exposed to less than enough to cause disease, will your body develop antibodies that will help you if you are then exposed to a larger quantity? COVID-19 is primarily spread from person to person. You can become infected from respiratory droplets when an infected person coughs, sneezes, or talks. You may also be able to get it by touching a surface or object that has the virus on it, and then by touching your mouth, nose, or eyes. The amount of droplets a person is exposed to can affect how likely they are to become infected and, once infected, how severe the symptoms become. The minimum amount of virus necessary to make a person sick is called the minimum infectious dose. Viruses with low infectious doses are especially contagious in populations without significant immunity. At this time, the minimum infectious dose of COVID-19 is unknown so far, but researchers suspect it is low. Additional studies need to be conducted to answer the second part of your question regarding the body developing antibodies if exposed to COVID-19 but not being infected. The body's immune response to COVID-19 is not yet fully understood. Also, it's too early in the study of the illness to even compare it with other coronaviruses. Thank you for tuning in this week, and thank you to everyone who sent questions. Be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.